I suffer from migraines and headaches, and my headaches vary. Every day they're different places. Like normally it's on my right side, 70%, or
You're pointing to your
left
left.
side. That 70% of the time it's normally on my left side. The other 30% of the time it's on my right, but my headaches every 5 minutes can be somewhere different. I get them a lot, back here, a lot on it could be like my whole left side. Lately in the last several years, it's been like my face hurts. It's like the whole left side of my face, including my eye and my jaw hurts awful. Just like everything to the touch. But I mean, they can be in just one little spot, different tendencies like throbbing, sharp pain, numbing. And then 5 minutes later, it's going to be here. And they move around. There are definitely different types of headaches. I had one the other day, and it was on my right side. Super, doesn't happen very often. But it was like in my eye and on, a lot of my right side of my face. But there's no really direct spot that I get in more than the other places besides the left side compared to the right. Well, it's been a severe problem since on October 8th of 2005, I slipped and fell. Landed on the back of my head, was unconscious for 5 minutes, and then didn't go to the hospital. But then the next day, we went and got checked out, found out I had a 2.5-inch blood clot on my brain, and cracked my skull, which caused the blood clot. Got life started to Kansas City. Ever since brain surgery, they said that like 6 months from brain surgery, I wouldn't have any headaches. But it's been over 10 years now, and they've progressively gotten worse. I used to not be really light sensitive, smell sensitive, anything like that. Over the last 5 years, that has progressively gotten worse. Well, like when I have a headache, like if I don't feel awful, then I'm okay to be around sunlight or fluorescent lights and things like that. But if I have a bad headache or a migraine, being around any type of light, it's very painful for me. I want to be in a dark room. I want to be in bed. I'm more sensitive to any type of smells. But I didn't used to be like that. The beginning of all this, the first 3 to 5 years, I wasn't near as sensitive to any of those things. So over time, things have progressively gotten worse. Every symptom has gotten worse. The severity of my headaches and migraines have gotten worse. That's one thing I've really struggled with. I haven't been able to find any triggers for my headaches and migraines. I've done the diets, the diaries, the everything. I mean, I cut out gluten and sugar and everything for 2 or 3 months, dropped 20 to 30 pounds by only eating meat and vegetables, to try to see if that was a problem. That didn't phase my headaches. I still got them. I cut out alcohol. That didn't, for 3 months, that didn't phase them. I cut out, I've done all the journals and diets that have been advised, and nothing has lessened my headache or frequencies or severity of them. The last month or so has been pretty awful. I've had, where I pretty much, if I wasn't at work, I was home in bed. It does cause me to miss a lot of work and miss a lot of social events and family events, which is very hard. On average, I would say probably 3 to 4. That's, also with appointments. I come in late a lot of times. I would say roughly around 20. Between headache doctors and specialists, neurologists, normal, just your practitioners, the dentist side of it now, which is new in the last 6 months for us to try. chiropractors,
Emergency
rooms. I mean, there's several different chiropractors. I've tried different types of chiropractors.
Got it.
Probably roughly around 20-ish. I mean, it's hard to
You did
pinpoint.
acupuncture or whatever.
Yeah, did some acupuncture. My number 2 issue, I have severe leg weakness. I have my whole entire life. I can't walk up a flight of stairs without using the railing.
She looks like,
I look like an 80-year-old woman trying to get up a flight of stairs.
yes,
I
she
can't.
does, and always has.
Yeah, I can't run. I mean, I can, but it's not fast, and
it's not pretty.
Yeah, I mean, we had talked to doctors about it, but they just kind of always wrote it off. Completely didn't
Just
acknowledge it.
They didn't really acknowledge it. Kind of like, well, this is how she is, and
I mean, I brought it up to numerous doctors, and they just didn't really follow through with talking about it after I brought it up. Everything. I mean, I don't have the strength to do your daily activities of picking up things, and I mean, even with like my nieces and,
running around with them.
Running around with my nieces and, just going on long, I mean, even if it's, let's say I'm camping or hanging out with my friends and we go on a walk and we're walking uphill, like it's way more strenuous on me to do something like that than it is for them, and it's just a walk. But me not having that leg muscle build up, I can't just walk up a hill and it not faze me. Like, I'm really out of breath. It takes a lot out of me.
Okay.
And so, I mean, it's a daily, I mean, it's weird that I have, after 31 years, I am always thinking about, okay, I'm going to be at this place. I'm going to have to walk up this flight of stairs. How am I going to play it off? And, just crazy little things like that. But that's part of my life. I've just, kind of like my headaches, I've kind of just learned to, I just make it work. My muscle tightness. And,
Which area?
My shoulders. And, I mean, I just constantly have knots here and under my shoulder blades.
Mm-hmm.
I mean, it's awful. They're always in pain. I mean, if anybody remotely goes and touches my shoulders, it's just like, please rub them. It's just all around here, the whole back of my neck. Really, the neck I've noticed just in the last 6 to 8 months is really when it seems to be where it's gotten a lot more sore and tense, and feels really good when I get a massage and get that rubbed and things like that too. Not very long. I mean, normally in a day or two. I mean, I've got the knots back normally pretty soon after they've rubbed them out. It definitely helps, and it just kind of relaxes me a little bit, but the knots come back in no time. Gives me that downtime that I need and helps, at least relax a little bit, and it feels good. I mean, I guess if I could have, all that stuff taken care of, I would love for my teeth to be pretty, because I know they're jacked up looking, but I had braces when I was in 5th or 6th grade, but then I never wore my retainer, and so they went back to this.
She does a great job of masking her headaches. Most of the time, people have no clue that she's having a 3 or a 5 or maybe even worse headache, and and then she and I will talk, and I can tell a lot of times when she is, but even I don't know. She smiles through and works through these headaches and migraines, and and then she gets upset with herself when she does get tense, and maybe sometimes tense with me, and it really bothers her that she saves up and sometimes gets upset with with me over small things, but she works through everybody else.
Yeah.
So
Well,
that does affect her life.
It's easier to be fake with everybody else because nobody wants, everybody, how are you doing today? Nobody wants me to be like, I feel like shit. I feel like shit and I don't want to be here and I want to be in bed. Nobody wants to hear that every day. So it's easier just to put a smile on my face and say, I feel
But you let your hair done with mom.
Yeah, and then my mom, I'm not married, I don't have a boyfriend, and it's probably a damn good thing right now. But so she's the one I vent to, and I can be a raging, horrible person to, because she's not going to leave me. And, she's the one that knows about my headaches all the time, and the one I cry to, and the one I vent to, and, I can be completely awful to her, but she knows it's because I've got all this pent up anger and frustration because I'm so fake to everybody else. I mean, most of my family doesn't even know I feel like hell most of the time. My friends, my coworkers, I have to play it off. I have to have a paycheck. People are always like, just go on disability. Well, and sit on the couch and get fat and not do anything. I don't want to do that, and things like that. And I fake it a lot, and people have no idea. So when I go to these inpatient or out-of-patient treatments, or I'm going to these doctor's appointments, and I have these god-awful medical bills, they're like, what's wrong? You just get headaches, and they don't understand. But it's night and day. I'm doing so much better. I went from having daily headaches and migraines, at least, or really bad debilitating migraines once or twice a week, to now just getting a bad headache or a small migraine about once every week and a half or so. And it's improved everything. Yes, just in Texas, and I head to Minneapolis next week, which are huge things for me. I mean, that was something I'd always feared when vacationing or doing work trips or anything like that, and how to be so prepared to have that I was going to have a migraine and what medications to have and everything like that, to be able to treat it. And now to be able to go somewhere and that not be my main concern and make me worry for weeks prior is huge. So that I couldn't be happier. I don't wake up with a headache every day, and I might get a bad migraine once a month. If that, definitely even the intensity of those has lessened. I still have my bad days, but they're a lot more manageable and not as frequent. So that's helped so much in my whole life. I mean, with my job, my personal life, my attitude, I'm not as irritable, I'm not as unhappy and sad because I feel awful every day. So it's really improved every aspect of my life. And yeah, I did Botox for about 2 years, I believe. I also went down to Springfield, Missouri to a headache clinic and did outpatient for a week there, where we did injections of DHC. And those were injections I give in my legs and thigh areas. I did that for probably a good year and a half, which was very unbearable and very, very painful. Those didn't really help either, and that was something I give myself, so that's kind of not fun. Got really tired of doing that. We knew it wasn't medicine related, because we tried everything from like seizure medications to anything that could be heart related, anything like that. So it was nice to get off medication, and we had gotten hooked up with a dentist that thought that there was more to it than that. He was unable to really help aid in anything, but he knew where to send me, which was here to see Dr. Raman, which was life-changing. Really was able to dig in deeper and didn't just go to pushing pills and pushing medication. Improved about 75 to 80%. Yeah, it has improved a little bit, my stability and balance overall. I'd say it's improved about 20%, 25%, something like that.
Okay.
when it comes to balance, any little improvement helps.
Yeah.
So that has improved a little bit. I'd say a 10 to 15%. Yes, that has improved probably about 50%, but I've been able to improve the flexibility and movement of my neck quite a bit, and there's not as much strain. I've learned how to, through physical therapy that Dr. Raman sent me to, was able to kind of learn better posture control and how to hold my neck and how to do things like that. I've got friends that live out of town now, so they don't see me as often, and when they come back, they, within 5 minutes of seeing me, instantly could notice a difference in my attitude, and I'm smiling more, and I'm happier, and just more bubbly, which is what they're used to, what they knew me to be years ago. And so that when you go through everything and feel bad every day, it's hard to keep that smile on your face, and they see me through a lot of horrible times, and so it's been very much noticed by everyone how my personality is back to where it used to be, how it's really changed and improved, and my attitude towards everything, just my attitude and outlook on life, knowing that there is, things do get better. After 11 years and getting worse and worse and worse, you start to wonder if it can get better. And so being able to see the positive sides and be optimistic about it, it's completely changed my life. And my mom is my best friend and sees me through everything and knows every step of the way, and she has been able to notice just the dramatic change it's had on me. My personality is, and my attitude and everything has done a 180 completely. So it's been life-changing, to say the least. Well, I've been suffering from headaches and migraines for, it'll be about 11 and a half years now. At that time, October of 2005, I believe, I had an accident, had fallen, cracked my skull and had a blood clot on my brain and had to have brain surgery. To remove that. From then on out, I started getting migraines that just kept getting worse and worse and worse. And the surgeon said that after 6 months of surgery, I should never have any headaches. So that was kind of depressing, and we didn't really know why that was happening. So we started seeing some doctors, going to neurologists in Topeka, and they just wanted to kind of push medication. So I definitely tried everything they recommended, gave it a good shot. A lot of times, it definitely was some things that made me not feel so well. The side effects of the medications, got over medicated many times. We then, tried, we went to numerous. I did Botox for migraines, which was about 30 injections at least every 3 months all over my forehead and my head. I did that for about 1.5 to 2 years, maybe, every 3 months. Didn't do anything, didn't help at all. After that, we then went down, I'm not sure how we got referred down to the pain clinic in Springfield, Missouri. But there was a doctor down there, Dr. Dexter, that had a headache clinic that he only dealt with people with headaches and migraines. So we went down there, and he didn't even really try any pills because I had already been on everything that he normally would do. I'd taken every medication from blood thinners to things for epilepsy, and so he started me doing DHE, which was a injection.
Mm-hmm.
We went down there for a week, outpatient appointment, and then so we tried things out with that. Sent me back home with that, which was a very expensive and hard medication to get a hold of. but we did finally find a way to get that. And then so I just started doing that myself, giving myself the injections, which was absolutely awful. The pain of having to do that, it made knots all over my legs and incision spots. It made my leg muscles even more weak and hurt. That I don't really recover from that. So we did that for a while. It wasn't working, and so he then said, he was very open and honest and said that he didn't feel like he was able to treat me, and he referred me up to Michigan to a head and pain hospital up there. So we went up there. We were up there for 2.5 weeks. It was an inpatient place at the hospital, so I stayed there for that long of time, and they did all sorts of medication and tests. They did nerve blocks and a spinal tap, and every day was a new trial of medication. Okay, this didn't work, let's try this and this and this, and nothing helped. I ended up going, I think when I was before I went there, I was on 2 or 3 medications, and I came back on 10. And I was so extremely over-medicated, I couldn't, it took me weeks to get my body to kind of be able to function good enough to go back to work full time. And then I was so over-medicated and drugged up that I couldn't really fully function on those things. I would call them and stress to them what was going on, and they'd say, well, slow down on this one or whatnot. But yeah, it was several months that I did it, and then I just took myself off the medication since they weren't helping at all, and they were kind of making my life worse because I looked like I was really high the whole time. I am a director of contracting at an insurance brokerage firm. Yeah, so I've always got to be on my toes. I'm head of a whole department, so I've got 10 employees under me. So I always need to be on my A game. So that's one thing that I've struggled with, was being able to maintain work, but I always have. I've kind of just been able to suck it up and go. Sometimes I can't, and they're very understanding about that. But I work hard when I'm there, and they know I care about it. So that's why I have the position that I do. Mm-hmm. So after that, we didn't really do much, because we didn't know where to turn. Well, when I had my accident, I had just turned 21. So, this was all going on through my 20s. So, when I'm supposed to be out having fun, I have, friends that were getting married. I had nieces, I was missing weddings. I was missing my niece's birthday parties. Vacations were miserable, things like that. I never looked forward to anything because I was always too scared that I wouldn't feel well. And that's not a life to live. Like every day I had a headache. And then every single day I had a headache. And then some would be migraines, and they would be 1 to 3 days long. And you can only be in bed so long before you are just so stir crazy. And all I'd want to do is sleep so the pain would go away, because I didn't have anything that would help with the pain. So we had a family gathering a couple years ago where my mom had spoken with a third cousin, something like that, who worked at a dental office in Marysville with Dr. Hamill. And so she had talked to Mom about all the things that he does. And so Mom came back to me and told me everything and said, hey, let's try it out. So I went to him several times. He ran tests, did things. We then started with the fixed orthotic. Mm-hmm. He was always very compassionate and a very good guy. Everybody in their office was amazing. So we had gone there and decided to do a fixed orthotic. I continued going to him, and I wasn't really seeing much improvement. I finally just kind of broke down to him and told him, with the cost of things and not seeing the improvement and the drive, it was a 4-hour round trip for me. So that really cut into work, and it cut into a lot of things. So he wanted to help. Like he didn't want to just stop and give up. And so he knew that, he wasn't able to help me. And to be able to admit that and then reach out to find somebody else to help you is huge, because a lot of doctors are like, oh, sorry.
Early on in this process of the complications that Tracy was having, she visited with neurologists, and they would suggest maybe that she would visit with psychologists. We just kept plugging away, and I guess throughout this process, I just got to thinking that there's going to be some breakthroughs in the migraine world, and that there's got to be treatments out there, that we just have to keep plugging along.
You were just not willing to give up.
I was not willing to give up, and Tracy, she was miserable enough that she wanted to continue looking as well, and so it was through all these different processes that really brought us here. And I'm not saying that we would have gotten here the first time or two around, because it's just kind of a unique process, a unique treatment that you don't think about when you're considering migraines. We never think of that being jaw or tooth related. Well, and I think we're just so ingrained that everything can be a quick fix, that the doctors, they have a pill for everything. And in reality, that's not true. And, because we are so ingrained in that is our first plan of action, is go to a doctor.
I would go to the ER, after, 2 to 3 days of not really being able to get out of bed. I'm not eating, I was dry heaving, I just couldn't function, I was getting dehydrated. I go to the ER. Well, you don't look pretty after going through that for a couple of days, and unfortunately they treat you like you're just there for pain pills and medication and things. And I know they have to do that for certain reasons, because of the issues that go on in the world. But I was I would just be like, I just want an IV. I don't even care if you give me anything, just I need to not be dehydrated. I just need an IV to get some fluids in my system and things like that. So that was really hard to deal with, being treated really crummy when I already felt very crummy myself. So there's definitely been a lot of obstacles, and I won't ever give up. I get down and out sometimes. I think that's normal for anybody that deals with any issues. But coming here has definitely helped me a ton. I know there's other things that I can do to keep getting better, and we will continue doing that too. But this has helped me tremendously. I mean, it's night and day from how I was a year ago before we started. And the compassion and the care that your facility offers was huge.
Tremendous.
There's no words to describe that when you went through hell for years of people, don't care. You're a patient, get them in, get them out. Here's medication, this and that. And, you calling me before my first appointment and just wanting to know things, wanting to know everything, wanting to talk to me. I believe I probably broke down on the phone with you the first time we spoke, just because I hadn't had some stranger or a doctor ever reach out to really know the story. Normally you go in and it's like, okay, how do you feel? Where is it at? Okay, blah, blah, blah. You truly wanted to know the story, wanted to know me as a person so you could help me and go the extra step in that. You don't find that. And it's sad that our medical industry has kind of come to that, of not, kind of losing that compassion and losing
the human touch.
Yeah, the human touch. But that's something that you guys offer nonstop, and it's huge. I don't even know if you realize how important that is to your patients, but it is. Good. I've been doing great. You look, and that's just it. You look at the whole picture. You're not focused on just this one tiny part. And because the whole picture, every little, the millions of details in there can affect anything and everything. So the process of all of it, you know, a lot smoother than I expected. I mean, I had painful days. I had some really crappy days, but for the most part, I wasn't near the pain I thought I would be. I don't know if a lot of that also deals with my pain tolerance being higher since I've, you know, things like that over the last 11, 12 years. But everything's going really smooth. The fact that I can call you or text you at any time and you're in a different country or an airport flying out and you text me back, and then, I mean, who does that? That's huge. And then the next day you're texting to see how I feel, you know, checking up on me, following up. So having that's beyond, it's amazing. So the process of everything has been really, really good, really smooth. I mean, you guys are always very willing to work with me on things and help me out and give me advice if I have some random sore or something odd going on. You guys want to know details. Send me a picture of this. Do this, do that, you know. And so that instead of, okay, come into the office, because you guys are an hour and a half away, so, which I know is very close compared to a lot of your clients or patients, but it can still be an inconvenience. So the fact of you guys being able to help me via text and picture, that helps a lot. I would say 75 to 80% improvement. I don't have the daily headaches that I used to. I still get them every once in a while, but if it's just a really minor one, I can take aspirin or Tylenol, and it helps. Where before, I could take a whole lot. I mean, I could take a lot, and I didn't phase them, you know, and nothing over the counter helps. So, I mean, that proves a lot right there. And then the really debilitating migraines where I can't get out of bed, those have definitely lessened. I still get one every once in a while. I think that a lot of them are weather related too. Yeah, I have seen a little improvement. I not a ton, but there has been some improvement. That's hit and miss. Some days are better than others. I'd say maybe 40% better. That's gotten a lot better. I'd say that's closer to 75% better. Well, it's definitely, when you feel good, you act better, you smile more, you're happier. That was something that was really wearing on me. I mean, I spent my whole 20s feeling awful. So, of course, I was depressed and down, and I wasn't the happiest person all the time. I was not always the nicest person to my mom. She would unfortunately had to deal with the brunt of most of it. But I mean, I have friends that, you know, I haven't seen. There would be times I hadn't seen them for a couple of months, and within 5 minutes of talking to them, they called me out on, wow, like, you seem happier, you seem better, and we can tell that things are getting better. And it's just my attitude. I'm a lot more positive. I'm a lot more, I'm not as irritable, and my patience is better. Just when you feel better, your everything's changes and everything's better. So,
you know, it seems like forever and ever and ever, our conversations, our phone conversations, it was always about her pain. And you know, she's in bed today. She just feels horrible, her attitude, and was, you know, not good by any means. But, you know, you try to be compassionate, and you try to soothe them in any way you can, and usually there's nothing that you can do. Now, it's fun talking to Tracy again. It's great to see that she has a life again that's worth living, and she's not just getting through, but she's actually enjoying her life again. And you know, anytime you see a child going through pain that you can't help them with, you just feel lost. You feel like their whole life is out of control. And when their life's out of control, your life's out of control. And now I feel that we have Tracy back. Maybe not 100%, but we're working on that. She says 70 to 80%. I'm striving for 100%. And I think there's still some work that we can do. And Dr. Rama's checking into some other avenues for us. And, and that's what we love about his clinic here, is that they don't give up. They want to find, they want their patients to be at 100% as well, and to give them back the life that they once knew. So.
Oh, I think we would definitely do the same.
No
doubt. I mean, there's no doubt we would do the same. How quickly we were able to do everything. I know it was there. You have the different avenues you can go down. The one that we chose was best for me. It's I think at my age, doing it kind of the quicker way, opposed to the other option that was, pulling the teeth, like growing the teeth, which could take several years and things like that. I think doing it the way we did it is definitely what was best for me. But as for the cost and things like that, we wouldn't change anything.